For the sake of time in this video, I'm gonna every joint that I talk about, I would inspect and palpate, and I would do resistance along with passive range of motion. So first, we're gonna start with the cervical spine, checking for alignment, getting to C7, the bony prominence there, and then range of motion here, spinal or cranial nerve 11. So we're doing flexion forward, and then extension, and then rotation looking side to side, and then lateral bending. And then with resistance. Checking shoulders, palpating the joints, and then range of motion. For this, you're going abduction, adduction, and then external rotation, internal rotation, and then doing it with resistance. And then at the elbow, palpating the elbow joint, finding the olecranon process, right there, bony prominence, and then medial malleolus on the inside, lateral malleolus out here in the lateral aspect, and then doing flexion with resistance and passive, and then extension. And then doing pronation and supination, hands up. Okay. And then moving to hands and wrists, checking all the metatarsal phalangeal joints, checking for nodules, could be signs of things like rheumatoid arthritis, and then doing flexion of the thumb, flexion of the fingers, and doing extension of the wrist, flexion of the wrist, and then radial deviation and ulnar deviation, and then just checking rotation of the wrist as well. And then checking grasping strength and grip strength, both sides bilaterally. And then doing the Phelan test, so you have them put their hands together at 90-degree angle, let their hands 90-degree angle, and then let the hands dangle, relaxing them for a minute. If they have any numbness or tingling, it could be a sign of carpal tunnel syndrome. And then doing the Tinel sign, so having them supinate and tapping at the median nerve to check for any numbness and tingling in the median nerve zone. And then moving on to the lower extremities, you're checking legs and feet for any swelling, edema, discoloration, any varicose veins, and then I already checked my femoral, popliteal, dorsalis pedis, and tibial pulses in the cardiovascular exam, and I also did, we'll do cap refill down at the toes here. It should be less than 3 seconds, and it is. And then moving on to the hip, so having the legs straighten out, and then doing flexion of the hip, so leg is straight, have them bring it up, and then this is the Lasag's test, so you can test for sciatic nerve damage or pain, and you kind of just bring it up and see if they have any of that numbness or tingling in their lower back or into the upper buttocks region. And then doing extension of the hip, so you have them flip over in pronator or in prone position, and then extend the hip. Okay, and then you can go ahead and flip back over. And then doing abduction of the hip, so out, and then adduction back in, and then have them in the upright position, sitting up, and checking internal rotation and then external rotation. And of course, everything is with resistance after you do passive range of motion. So then checking the knee joint, checking the popliteal space. You can feel and listen for crepitus in here, which can be a sign of arthritis. So then extension of the knee, and then flexing of the knee. And onto the specialized test, so the bulge sign, you have them knee, and they're in supine position, and you sweep the medial side, and then you sweep the lateral side to see if any fluid bulges back on the medial side. And then the ballottement, you're going to take your hand, put pressure on, bring it down to the very top part of the knee, and then come up from the bottom. and keeping that pressure downward, and then taking your pointer finger and pressing on the patella bone to see if it feels like it's floating. If it is, that can be a sign that there's extra fluid or effusion in that knee joint. And then the McMurray's test, we're checking for meniscus tear damage. So then you're rotating it out to see if it feels loose, and then rotating it in more medially. And then the anterior and posterior drawer sign, checking for anterior and posterior cruciate ligament integrity. Anterior, bringing it forward, pulling forward on the lower leg, and then posterior, pushing back against, and they both are feeling stable, which is a normal sign. So then inspecting the ankle and foot, checking both ankles for any swelling, and then doing dorsiflexion and plantar flexion with resistance, and then inversion and eversion outwards, and then flexing the toes and extending the toes. There we go. And then moving on to the spine. So sitting up again, and checking alignment of the spine, checking for any scoliosis, kyphosis, which would be slightly forward there, and then lordosis, which would be forward more at the bottom. And then doing flexion of the spine, so leaning forward, and then hyperextension of the spine, so having them lean back, and then bending to the right, checking lateral, and then twist or rotating at the hip. And then you're also just making sure to palpate the paravertebral muscles of the spine.